Hi, so welcome back. So the next video, I'm going to talk about pressure point care. So it's quite vital in hospital that we move patients around who don't normally move themselves around because they're unable to. Because what happens here, on these parts of the body, the shoulders, the back and the elbows, they're all pressure. So they can break down, the skin can break down really easily because the oxygen in the blood is not flowing through to those areas because they're laid flat. So it's really important that we move the patient. Now, if your district nurses are coming around and they administer the pain relief, it's a really good idea to do it then. You can also give them a little wash after you've given pain relief, but it's always key to have that before they're moved. So my dog will appear shortly. I'm hoping she doesn't, but she might do. I'm just going to carry on with the video. So it is really important. So the sacral area, which is here, can get quite sore as well, along with all the other areas which I've shown you here. So it's really important to move your loved one as much as possible. It might get quite difficult toward the end because sometimes they're in quite a lot of pain, or they're just comfortable to be laid in that position. But I would impress the fact that they may already be in pain, and the skin deteriorating in these areas because you're not moving them can cause severe pain. So you don't want to add to that pain. So it's really, really important for movement if possible. Sometimes it's really not possible, but it's just really to let you know if you've got somebody to help you, it's even better. I mean, Fee's quite a small lady, so it will be easy for somebody like me to move her on my own, but always ask for help because it can be quite difficult and you don't want to hurt your back or anything like that. And there's no easy way to do things, and you're not in a hospital, you don't have policies and guidelines how to move people, but always try and look after your back when you're moving your loved one around, because obviously you need to look after yourself as well. So just bear that in mind. Also, I'll just tilt the camera to Fee's legs. The other areas which can be quite affected are the heels. And you might find when your loved one has been in hospitals, the heels are lifted up with pillows or they're on an air mattress, and that is to relieve that area as well. So all these areas where the oxygen in the blood isn't getting to because of pressing down, it's a bit like a hose pipe. If you put a kink in a hose pipe, the water can't get through, and after a while it's just going to fracture and break, and that's like the skin. So we must take care of the skin. And you know what's really nice, when you're washing somebody, you can turn them on the side and you can use oils or creams, whatever they would like to be used on them. When I get a shower, I always put baby oil on when I'm wet, and that's my preference. So and my children know that, so I'm sure they would do that for me. So that is really regarding pressure area care and how important it is. Also, just to mention the ears as well, they're also a pressure point, and some patients who are in ICU have breakdown of ears because they might have to be on a breathing machine and they have plasters over their ears to stop but if you're laid on your side, sometimes the skin on the ears can break down, so that's really important as well. So they don't need to be on the side for too long, just so that the oxygen and the blood can flow to that area and give some relief. Okay, so thank you.